Welcome at this presentation of the Long COVID Toolkit. This project was initiated by two Dutch persons with first-hand experience with long COVID. To the left, Edo Plantinga. Edo works as a freelance IT project manager. He was the community manager for the national open source Corona app Corona Melder, overseeing a community of thousands of volunteers contributors. He has expertise in user experience design and is a former startup founder. He holds a university degree in artificial intelligence. And me, I'm Joanneke van der Nagel. I'm an epidemiologist and a psychiatrist, and I work at the University of Twente as a senior researcher in the field of technological innovations in healthcare. So why did we come up with the Long COVID Toolkit idea? Well, long COVID is a disease best treated using a multidisciplinary approach, but such care is often limited accessible. Fortunately, there are a lot of things that people with long COVID can do to alleviate their symptoms, such as pacing, reducing stress, taking supplements or medications that have been scientifically shown to help. However, it can be hard to find comprehensive research-based sources of information about these interventions. The Long COVID Toolkit will be a website that aims to provide information in a user-friendly and accessible way. This presentation gives an overview of our plans. This presentation aims to inform all of you and to find partners and resources to build the Long COVID Toolkit collectively. Hence, feel free to send this presentation to whoever is interested. As multidisciplinary care is not easily accessible, patients need to be their own experts. However, this can be difficult without reliable information. The internet provides information from different. So let me introduce you to the toolkit. Based on our research, we envisioned the contents of the toolkit to be divided into a description of long COVID and what to expect as a patient, information about supplements and medications, and I will show a prototype in the next slide to see how information will be presented in a thorough yet actionable format, descriptions of diagnostic tests and self-assessment tests that can either be done at home or in a clinic, information on pacing and other interventions such as dietary changes, vagus nerve stimulation, stress reduction, breathing exercises, stretching exercises, and so on. The Long COVID Toolkit is unique in its approach, combining two dissimilar sources of information on each tool: scientific literature and patient and treatment provider reviews. However, on our website we do not want to provide medical advice. This is a prototype of our website's presentation on a medication or supplement tool. In the Research tab, as well as several ratings on the Summary tabs, the user can see important information about the tool, including the strength of evidence. Safety and evidence for each tool will be summarized based on literature review and presented in an accessible format. Categories of tools and symptoms allow for a targeted search of the toolkit. The Long COVID Toolkit will be accessible without user account. However, persons with an account will be able to store, for instance, their favorite tools. Though the Long COVID Toolkit contains a lot of information, the use of different tabs results in a good overview and additional information for those interested. Detailed background information will be provided for patients and treatment providers alike. Dosage and safety information can be found in the Dosage tab. And all of the scientific evidence will be complemented by patient and doctor reviews of the tools, thus combining scientific and experience-based knowledge. So where are we now and how do we proceed? With the toolkit, we aim to reduce the burden of disease of long COVID. We do this by empowering people to become experts on their own condition, making information actionable, for long COVID survivors, doctors and other medical professionals, helping individuals and their doctors to find evidence-based intervention, and allowing a more structured and insightful knowledge sharing between people with long COVID and other persons. Improving knowledge sharing between researchers and strengthening the evidence of which interventions work best through rating scales and data analysis. We will encourage widespread use of the information in the toolkit. This means that the content can be freely reused. Only an attribution to the toolkit is required. This will encourage reuse in other websites, patient brochures, etc. We work with open data and open source. The user data generated by the toolkit, for example, when they started a medication and what effect it had on standardized questionnaires, will be freely available for researchers. Of course, users can opt out for this use of their data. The programming code on the website will be available free of charge, so it can be reused for other diseases. Also, the toolkit will be not for profit. Funding will be sought through grants and crowdfunding. We believe this will encourage others to donate their time and expertise to this project. Our approach is community-driven. Many people with long COVID have relevant skills and expertise and are highly motivated to help and share their expertise. It's from these strong long COVID networks that we build on. However, there's also a risk in relying on patients. This is why we use a buddy structure, in which all persons in critical positions have a backup and collaborative partner. So where are we now? We put a lot of effort in need analysis, planning, and building a prototype website. Our project was awarded a grant from the Dutch government to complement the first 10 tools. Currently, we're starting a crowdfunding to be able to expand the project. And we're quite busy to start the build of the final website, seeking out partners and volunteers, and of course, write the content. The Long COVID Toolkit will be a community effort with a core team of paid professionals. So if you want to join our project, check our website for more information. Thank you for your attention.